Alderneys Key FM.
Okay, well, good morning, everybody. Friday again, another week where we have not had a positive test, which is a really good thing. The latest test results from Guernsey indicate that there are now 34 confirmed cases of COVID-19, all of which are on the island of Guernsey, and we do not yet have a confirmed case in Alderney. We still await some test results both in the bailiwick as a whole and in Alderney. The good news is that the test results are coming back more quickly. There are now 61 outstanding tests in the bailiwick, which is an improvement. Dr. Nikki Brink, our Director of Public Health, is doing a great job for us. She has developed a strategy which is designed to serve the needs of our island. So the way in which she has gone about this work is a way which has proved to be successful. So the planning and the implementation of the strategy is working, and we are slightly ahead of the game because we have all those provisions available to us, and we have yet to have a positive case. So the longer we can delay this virus, slow it down, isolate it, the more we will be able to cope and the more lives we will protect. The strategy here is all about being active in finding cases by testing whenever we need to. It's about isolating people when they are diagnosed and when we are waiting for test results. It's about tracing the contacts of anyone who gets the virus and isolating them. And it's about understanding the virus and how it migrates through our community. The facility for on-island testing in Guernsey, which we hope will be available soon, will give us a massive step forward because we won't have to send the tests to the UK. We will be able to test on island, so we will get a much better picture more quickly of how we might have to change the strategy for dealing with this challenge. So once again, we're in a very strong position there because we can test and we can interpret those results very, very quickly. So that's a real positive. Almost all of the 34 cases in Guernsey involve people who acquired the virus elsewhere. They are all isolated and their contacts are isolated. Only one case is thought to have been acquired in the community. So the virus is not yet widely transmitting in the community. But the strategy has been cautious. We have gone into a form of lockdown in response to the possibility that the virus is self-seeding in Guernsey. So we are reacting in a way that is much speedier, much more agile than the approach in the UK and elsewhere. So once again, we are extremely fortunate to be in a position where, having designed our own strategy, we can implement it and we can respond to the challenges at the moment they arrive. And that puts us in an incredibly positive position in terms of moving forward. I appreciate it's not always easy for people to understand the actions that are being taken, but please understand that this virus does not hang about. It is a silent enemy, and that being the case, we cannot be complacent. We have to consider that the virus could be anywhere, and once it gets a grip, you have seen in countries all over the world how quickly matters progress. So our approach here is to, should it be necessary, slow that progression down so we can manage it with the resources we have available on the island. So it's there, possibly. You won't see it, but we have to act as if we are all looking in the eyes of that challenge all the time. So I want to say a big thank you to everybody who has embraced the message, stay at home. We know it's not easy, but by staying at home, you are doing the best thing you can do, making the biggest contribution you can make to keeping us all safe. So if you are not an essential worker delivering a critical service for the island's health and safety, please stay at home. The decision to introduce these latest restrictions has not been taken lightly. I think we should admit that from the Guernsey and Alderney government perspectives, it is also a bit confusing, and directions that have been published have probably not always helped. We have had a lot of questions about whether people can or can't stay at work, and it is true to say that there is some ambiguity in the answers we have given. And I'd just like to demonstrate that point because we've had a lot of issues around gardening and whether or not contract gardeners can work or whether they can't. Now, there is contradictory information, but what all good lawyers do is start from the basis of what does the law provide, and the directions which have been issued, which have the force of law, provide one, critical seasonal horticultural work can be undertaken while adhering to social distancing guidelines. 2, no unnecessary travel should take place in the bailiwick. So the important word there, which has the force of law, is critical. So the question is having somebody's lawn mown critical? The difficulty has been that there has been guidance issued by Guernsey, and the word to focus on there is guidance. So it isn't the law. It's in the questions and answers. Can my gardener or cleaners come to my house or flat? Not if they or you or any member of your household feel unwell or have any COVID-19 symptoms. Otherwise, your gardener can come, provided they are in a group of not more than 2, do not meet the occupants of your household, and social distancing measures are maintained. Now, there is a very clear distinction and discrepancy between the law and the guidance. We are asking people to comply with the law. And so at the present time, until we have more clarification from Guernsey, our interpretation is that gardening work cannot take place unless, for example, it is a tree which is dangerous and needs to be dealt with quickly. So we do recognise that there is confusion, and we are similarly confused ourselves. So this matter has been escalated up and will be discussed at the committee that deals with the tactical matters surrounding this challenge, and hopefully we will get some clarity about that. But in the meantime, please, if you are a gardener, stay at home. I would just like to give a little insight into the preparations which the operational group has been making to assure everyone that a huge amount of thought and action is going into protecting and preparing for what might happen. There has been a lot of discussion about whether we have the right amount of personal protective equipment for the medical and emergency services on the island, and we have been quite resourceful in strengthening the resources we have in that respect. A lot of thought has gone into how we are going to manage to provide for anyone who needs hospital care and how we are going to medevac people who require it. So I just wanted to emphasize that it might feel like not much is happening in terms of the virus on Alderney, but this time we have had to help prepare. So this time which we have had to help prepare has been really important. And you might have seen some training which has taken place over the last day or so. So that's all part of the preparation. As far as the medical response is concerned, we're ready and we are able to deal with that challenge. We're also extremely fortunate to have Dr. Julie Hunt, who came last year as a locum, came back for a short time this year, and is still with us and will be with us until May. So she has agreed to extend her contract to provide us with specialist knowledge given her experience. And when Dr. Julie speaks, we listen, because she has vast experience in these matters. She is very direct. So when she speaks in the meeting, we all sit up. So the medical support we have is second to none. So don't worry on that account. We're all really like a team waiting for a cup final. We are trained, we are fit, we are healthy, and we're ready for the challenge. Finally, one issue I'd like to bring to the attention of listeners: we're making provision for some emergency accommodation which may be needed. This might be for additional healthcare staff who we need to bring to the island. It might also be for essential workers who don't live here but need to self-isolate here. We need to furnish that accommodation, and I'd like to make an appeal to anyone who could donate any of the following items which need to be in good condition. So what we're looking for is 6 single beds and mattresses, duvets, pillows and bed linen, pots and pans and oven trays, kitchen table and chairs, sofa and chairs, and coffee tables. Now, Barbara Benfield has already stepped up and offered the resources of the charity shop there, so we've got a good start, but I'm sure there must be people out there who have single beds which they don't need, so if we could use them, we'd be extremely grateful. And similarly, I'd like to put out a call to people who have rental properties on the island which are not being used for obvious reasons, and I would like to invite them to consider whether they would be prepared as their effort towards the fight we have on our hands to make those properties available for those key workers and the healthcare staff and anyone else we might need to bring onto the island. That would be a massive contribution, and I think we would all be extremely grateful to know that we have proper accommodation for people who are coming to help us through this crisis. So if you can help in any of those ways, please could you contact ceo@alderney.gov.gg, ceo@alderney.gov.gg, and the CEO, of course, stands for Chief Executive Officer, Mr. Muta. So just a couple of final things, positive things to start the weekend. People are continuing to volunteer. It's very welcome. They're getting a little bit frustrated because they want to help, they want to get going. But the thing is this: we have mobilized the community to be ready for when they are needed. So they have formed part of the preparation for the challenge we have. So the fact that we don't need a lot of volunteers active at the moment is a good thing. It means we are managing, and it means that they are there waiting for the phone call as and when it arises. Now, they've already been used, the volunteers, around Meals on Wheels, because the rounds have been split volunteers have been brought in, and that, I was told late last night, has been really successful. So a big thank you to all the people who've done that. So please, volunteers, be patient. We know you're there, and as and when we need you, we'll be in touch. Now, final thing, those listening earlier will have heard Hannah, who put out, or asked Dougal to read a statement for her this morning. If you didn't hear that, please listen to it again if you can't get it from any other source. But the Tate household used the shopping experience for the first time yesterday. It was as simple as you can imagine. So the boss lady emailed her order. She was subsequently contacted. They went through what she wanted on her order. They went round the store. If they had it, it went in the basket. If they didn't, they offered her an alternative. And pretty much everything that she had asked for went into the basket. And that was, we then got a phone call to say that it was ready and would be delivered, and it was delivered quickly after that. So I can't think of a better system to make sure that we all constantly have access to food. So it's a big thank you to the people who were involved. They know who they were, and I'm sure that that will be an experience that everybody will have. But please be patient. It might take a little longer than you would hope, but you will get your food. And the only thing I would say is that, Hannah, don't send Mick Barnes round, young Mick round with the delivery. It makes my beloved wife go all at the knees. So having a hunk deliver it is a bonus as well. So I think that just about brings me to the end of this morning's update. Just to ask everybody, stay safe, and we are up to the challenge. Dougal.
Lovely, William. Thank you very much. Well, I must say, I don't know if you're hearing me very well, but I heard you loud and clear, and I think the listeners heard you loud and clear as well. And it actually gives me a good opportunity now to read a spring newsletter with important information from Barbara, because I think it's all relevant. And it says, I will start by saying this is the strangest newsletter we have sent to date. We understand that there is some resistance to the advice that is being given and updated daily. I would therefore ask you all to take note of the advice given. The virus is a serious situation, and the people most vulnerable are the over 65s and anyone with underlying health problems. The advice is, keep your distance, do not stand closer than 2 meters to anyone, wash your hands frequently, and stay indoors. These measures are not only to protect you, they are to reduce the spread of the virus when we have it here. We would all like to think that it won't affect us. Unfortunately, it will. I understand that a lot of you feel that you came through the war and have experienced worse. Although this is true, unfortunately, this virus has a different way of attack. It can't be seen, it can't be heard, and it can't be smelt. So I ask again, please take notice of the advice and stay indoors for yours and everyone else's protection. You can listen to the updates daily at 9:15 on Key FM on 107.7. Also, you can listen again this evening at 9:15, and you can also we'll get it loaded onto the website, and you can get it on YouTube as well. So just to remind you again, it's Key FM on 107.1. 107.1, not 7. So 107.1. That's just a correction there. And I'll just say it again, on Key FM on 107.1. Alderney Spirit has been formed to protect you. They have over 100 volunteers prepared to deliver anything from your paper to your shopping. Telephone 07781 440 269. That's 07781 440 269. The chemist are delivering prescriptions and items from their shop daily. The farm shop, Gene Stores, Tesco and some of the smaller shops are offering a daily delivery service. Most of the eating houses are offering takeaways to be delivered. All of this has been put into place in order to protect our community. So please, as you see, you do not need to go out and put yours and other health at risk. Take advantage of what is available to you and isolate yourselves. It's not forever, and God willing it will be over sooner rather than later. Stay safe, protect yourself, and if you have any concerns, feel free to ring Barbara anytime on 077 81 123 637. That's 07781 123 637. I think that was an important letter to me read to you. And William, I don't know if you can hear that or not, but that was just the information that we were giving out.
Yeah, I heard that, Dougal, and I can sense a double act coming on here.
Yes. Okay, well, can I just say thank you as well for all your hard work, and it does seem to be working over the telephone. Although you couldn't hear me initially, I hope it's all right now. And we will be back again, of course, with you again at 9:15 tomorrow.
No, because it's Saturday.
No, we won't be. Well, hopefully we're going to have a quiet weekend then.
Right. Well,
excuse me if I forgot what day of the week it is.
Let me just say, if there is anything we need to get out there over the weekend, it will either be at 10:15 on Christian's show tomorrow morning, or whatever time you and I agree.
If we need to go live, we will do that.
Hopefully we can have a quiet weekend and we can all get round to doing all those jobs that we've been putting off for so long.
And yes.
Once again, stay safe. I'll speak to you on Monday.
Thank you very much, William.
Alderney's Key FM.